Today our topic is dopamine. Dopamine basically it is amine, monoamine, and it acts as a neurotransmitter. And dopamine is more predominant in midbrain. In midbrain neuron, dopamine is more predominant. Now the origin of dopamine. First of all, dopamine is amine precursor. So dopamine is derived from amino acid tyrosine. This tyrosine is converted into L-dopa by tyrosine hydroxylase. L-dopa is converted to dopamine by dopa decarboxylase, and dopamine is ultimately converted into norepinephrine. This norepinephrine go to adrenal medulla. This is adrenal medulla, and converted into epinephrine. And this is the origin of dopamine. So precursor of dopamine is tyrosine or L-dopa. So in case of dopamine deficiency, we can use synthetic L-dopa. Now, action of dopamine. Basically, dopamine act by receptor. There are 5 receptor: dopamine 1, dopamine 2, dopamine 3, dopamine 4, dopamine 5. In that all, dopamine act by G protein coupled enzymatic reaction. Basically, suppose it is a cell and there is a receptor. This is D1 receptor. This D1 receptor is activated by dopamine. Suppose it is dopamine and it is activated, and this receptor ultimately activate cyclinyl adenyl. This receptor ultimately activate adenyl cyclase through G protein stimulatory. So D1 receptor is stimulatory, GS. On the other hand, D2 receptor, suppose it is D2 receptor, dopamine bind, it inactivate adenyl cyclase through G protein inhibitory. That's why D1 is stimulatory, D2 is inhibitory. Okay. Now the function of dopamine. There is a lots of function of dopamine, but I highlight only 3 function. Basically, one is it helps in movement, it inhibit prolactin. That's why sometimes dopamine is called prolactin inhibitory factor. Then it also has some psychological effect. So this is the function of dopamine. Now, abnormal dopamine means deficiency of dopamine or excess of dopamine will cause dysfunction, abnormal. So when there is deficiency of dopamine, this function is less, and when there is excess of dopamine, this function is also excess. That is, when dopamine is less, movement will less. When dopamine is excess, movement will excess. When dopamine is less, psychological effect is less. Basically, dopamine deals with mood or feeling or reward, etc. When dopamine is normal in level, we feel good, our mood is happy. So sometimes dopamine is termed as happy hormone. However, when there is deficiency of dopamine, our mood is bad. That is called depression, sometimes termed. So when there is deficiency of dopamine, we feel depression, we in the depression, or we feel bored at anything. But when there is increased dopamine, this will increase. So we'll talk about dopamine increase. Plus sign means increase. When there is dopamine increase, the movement will increase. So movement will increase. That means it occurs chorea. Chorea means involuntary jerky movement. Something like that Michael Jacksonian dance chorea means. Then athetosis, etc. It is also dopamine when there is excess of dopamine, and it is also involuntary movement. That is chorea and athetosis. Then prolactin will more inhibited. Prolactin will more inhibited. There is no prolactin when there is excess of dopamine. When there is excess of dopamine. Then psychology. It causes, excess of dopamine causes some psychological problem such as schizophrenia. Basically, schizophrenia is caused by the D2 receptor. Here we go. D2 receptor is inhibitory. But in case of schizophrenia, there is excess D2 receptor. That means the inhibitory function of the dopamine is increased in case of schizophrenia. And some symptoms of schizophrenia is hallucination, delirium, delusion, etc. So it is the main three facts when there is excess of dopamine. But in case of dopamine deficiency, movement will less. That is Parkinsonism. Here movement is slow down. Then prolactin is increased. That is hyperprolactinemia. When there is a hyperprolactinemia, this causes gonadotropin releasing hormone inhibit. Prolactin inhibit gonadotropin releasing hormone. So in case of female, there is amenorrhea, and in case of male there is impotency or sometimes gynecomastia. Amenorrhea in female is agonist in impotency in male, gynecomastia. So when there is deficiency of dopamine, prolactin will increase, that means hyperprolactinemia. Prolactin inhibits gonadotropin releasing hormone, that causes amenorrhea in female, impotency and gynecomastia in male. Then some psychological problem such as anhedonia. Anhedonia means bored, that is he or she felt bored at everything. Anhedonia means feeling bored or feeling disgusting in everything, or we can call sad or depression, etc. So this is the function of dopamine, an abnormal function of dopamine. If we recap, first of all, dopamine is a monoamine. It is a neurotransmitter. Basically, it is an excitatory neurotransmitter. Excitatory neurotransmitter, and it predominant in midbrain. Then it originates from tyrosine amino acid. Tyrosine is converted into L-dopa by tyrosine hydroxylase. L-dopa is converted into dopamine by dopa decarboxylase. Further, dopamine is converted into norepinephrine, and norepinephrine converted into epinephrine in adrenal medulla. Then action of dopamine. Dopamine acts by dopamine receptor, and dopamine receptor act through adenyl cyclase enzyme by activating or inhibiting adenyl cyclase enzyme. D1 receptor activate adenyl cyclase through GS or G protein stimulatory. On the other hand, D2 receptor inhibit adenyl cyclase through G protein inhibitory mechanism. The function of dopamine is in movement. It inhibits prolactin and some psychological effect, that is mood, reward, etc. That is when there is a dopamine excess, movement is excess, as dopamine is excitatory and there is excitement in movement. So chorea, it is excitement or it is a involuntary jerky movement basically. Then athetosis, so also have excess of movement. Then prolactin will more inhibited or there is no prolactin, as dopamine is called prolactin inhibitory factor. And psychological problems, schizophrenia, we talk about here. D2 receptor is increased. So as D2 receptor inhibit adenyl cyclase or it is inhibitory factor of dopamine, that's why in case of schizophrenia there is increased inhibitory function of dopamine. And some symptoms of schizophrenia is hallucination, delusion, etc. And deficiency of dopamine also less movement, that is Parkinsonism. Prolactin will increase, that means hyperprolactinemia. In case of hyperprolactinemia, it inhibit gonadotropin releasing hormone. When there is less gonadotropin releasing hormone or no gonadotropin releasing hormone, it produces amenorrhea in female and impotency and gynecomastia in case of male. Then in some psychological effect of deficiency of dopamine is anhedonia. Anhedonia means feeling bored at everything or sad or depression, etc. So thank you all.